So we also now call it systemic inflammatory disease because two things, it affects the entire body and functionality of the body in different ways, and it is very inflammatory. It causes a lot of swelling, it causes a lot of release of toxic products which cause damage to organs. So that's basically what endometriosis is all about for you.
Hi, welcome to the Slow Fix. I'm Sanjukta Sharma. Today I'm talking to Dr. Anshumala Shukla Kulkarni, a leading expert on endometriosis. So many of you would know, especially women would know, that endometriosis is a chronic, painful, inflammatory condition that affects women in their reproductive ages. Millions of women around the world suffer from it, and according to the latest data, that number in India is 42 million women. So, as I said, it's a chronic condition. I have myself suffered from it for years. So, endometriosis is a disease that has come up in conversations, dialogues recently a lot. A few years ago, I would say it was a silent epidemic. Many women were suffering, they were struggling with, treatment, diagnosis itself. So now there's a lot of information about endometriosis. So my idea was to get a proper update, an expert update on it. What is really going on with treatment, care, are younger women suffering from it now? Why is it on the rise? So no one better than Dr. Anshumala Shukla Kulkarni. She practices at the Kokilaben Hospital in Mumbai, and because of her efforts, there is now an endometriosis clinic in Kokilaben, specialized care for endometriosis patients, which has got a global certification recently, which Dr. Kulkarni will talk about. So let's dive in to know all about endometriosis and what is new in its treatment and care.
Thank you, Dr. Anshumala Shukla Kulkarni, for your time. Endometriosis, is something that suddenly there's a lot of discussion around it.
Yes.
People are aware of it, and it's all on the internet, right?
Correct.
So with you, I just first want to get into a little bit of a basics and just a refresher on what the disease is. So, it affects women in their reproductive ages. What is endometriosis and how does it manifest? What are the implications of the disease?
Right. So thank you, Sanjukta, for having me here and speaking about this very dear topic to me.
Yeah.
And the thing is, traditionally 4 to 7 years for diagnosis of endometriosis is what we see across the world. And I think with the onset of COVID and Instagram becoming so popular, or any social media becoming so popular, thankfully, a lot of information is out there, because now people know, they don't accept the issues that come with endometriosis, and they're seeking help quicker.
Yeah.
So I think that's a very good thing that has happened with regards to this. But still, there are a lot of people who would not understand what endometriosis is all about. To be simple, this is tissue which is growing around the uterus. Okay, it is very similar to the lining of uterus which gets shed every month when you're having your periods. But this lining is growing outside of the uterus in different areas. It can grow generally more around the pelvis, around the uterus, ovaries, fallopian tubes. But it can grow in the diaphragm, it can grow in the intestines, it can grow in the urine bladder. It can sometimes go up to the lungs. It has been found anecdotally in some people having it in their joints. Very, very rare, but it has happened. So endometriosis essentially is this abnormal tissue which is growing outside of the uterus, very similar to the lining of the uterus, reacts to the hormones exactly like it does. So it swells up and bleeds every month, but the location being in odd places starts growing too much rapidly and damaging organs around of it. That's basically what endometriosis is all about.
Yeah.
But it is a disease which is associated with a lot of other issues. Systemic means the entire body also is affected because of endometriosis. So we also now call it systemic inflammatory disease because two things, it affects the entire body and functionality of the body in different ways, and it is very inflammatory. It causes a lot of swelling, it causes a lot of release of toxic products which cause damage to organs. So that's basically what endometriosis is all about for you. Yeah.
So it's an inflammatory disease that is not just limited to your pelvis and your reproductive organs.
That's right, yes.
So it can happen everywhere.
Correct.
So is it true, doctor, that endometriosis is increasingly happening in much younger women. Like I have heard of teenagers getting endometriosis.
Correct. Yes.
So is that something that's true in your experience? And
so adolescent endometriosis, which is endometriosis occurring in girls who are younger than 25 years of age, younger than 20 years of age, definitely we have seen an increased incidence. Also, I think like we said, the information is out there a lot more. So people are more aware and conscious of their own bodies, and if they feel that something is off, they seek help earlier also. I think there are enough instances of younger girls who've had period pains who come to us now at 40 years of age telling us, doc, this was there with me even when I was in school. I used to not attend school, I had to take breaks and I couldn't really function very well. And at that time nobody paid heed to it, and with God's grace they got married, got pregnant, so never actually got through investigations until they reach a stage when they are in a very severe form of endometriosis. So I think adolescent endometriosis has been around. The incidence probably has increased more because we are diagnosing it faster now. Patients are actually coming up with the symptoms faster now as compared to the acceptance which was there earlier on. That's, I think, what's happened.
And how serious is the disease's implication in fertility? Like, is it understood that women with endometriosis will have difficulty getting pregnant, or that's not the case?
That's not necessarily. Endometriosis, like I said, can occur in different areas. So a lot of times if your endometriosis is not affecting your fallopian tubes and ovaries, and it is there all around though, you can still very easily get pregnant. So, and it also depends on how severe the disease form is, how much of the organs is involved. So there was a classification by the American Society which used to say stage 1 level, like a stage 1, 2, 3 and 4 as the stage of endometriosis, depending on how much of involvement of organs it is occurring to, or the more specific NCN classification which we use, where we specify each and every point at which the endometriosis is occurring. So if your fallopian tube and ovary is spared, the uterus is spared, patients with endometriosis can very well get pregnant as well. However, those who have very severe form of endometriosis will always face difficulty, even if the ovary is not involved, is because the inflammation that is there, the markers of inflammation which are released locally in that area are very damaging to the oocyte. So the eggs are not very healthy. The embryo that is formed is not able to survive and actually give you a pregnancy. So definitely endometriosis affects fertility by damaging fallopian tube and ovaries, as well as changing the environment around the pelvis, not allowing pregnancy to occur.
And tell me something, this is something needs to be clarified, I think. So when I was in my 20s, I have gone through endometriosis. So I went to various doctors in my 20s who told me you should get pregnant. So is pregnancy a cure for endometriosis?
Not at all. So endometriosis is, like I said, it's a lesion which is growing and it is sensitive to hormones. So it follows the menstrual pattern of the hormones. So it will increase in its blood supply, swelling just before the ovulation occurs, and as the ovulation has finished and you are supposed to get your period, the swelling and the blood supply will increase even more, and it will bleed slightly inside the abdominal cavity. So this process is happening continuously because it is sensitive to the hormone as well. Now what happens when you get pregnant? You don't get periods. Right. So when you don't have periods, the level of estrogen hormone, the first hormone of the first 15 days of your cycle, is not as high. And progesterone, the second half of the hormone which is in your cycle, is very, very high. So progesterone is known to reduce the inflammation in endometriosis, which is why a lot of people felt that after pregnancy my pain got better. Yes, definitely for a while it will get better because there is some beneficial effect of this progesterone hormone which your body has naturally had inside of you, but eventually it comes back. So it is not a cure, it's just giving you a stopgap without taking medications or treatments, just giving you a stopgap from your symptoms. That's about it.
Right. And have any causes been established conclusively? Like, is it genetic? Is it lifestyle? Why does endometriosis happen? There seems to be no real
pinpointed cause to say ki, okay, this is why you got it and this I can correct. So unfortunately that's the reason why there is no cure for endo, because we don't know what triggers, which gene it is that is triggering this endo to grow in particular person. But yes, we do know why it grows in some people. So there is a disruption of your immune system. So remarkably what happens is these lesions are growing and our body is programmed in a way that our immune system, if it sees something which is abnormal, it will try to dissolve it and take it out of your system. But in patients of endometriosis, their natural killer cells, a type of immune system methodology which is there, that natural killer cell doesn't work very well. So because the NK cells are not working, they are not able to clear the pathway and take the lesions out of that area.
Right.
So they allow them to grow. And then what happens is the other immune factors which are there around are heightened in their reaction. So there is one part of the immune system which is underactive, not working, not clearing the lesions, and the other part of the immune system which is hyperactive. So that little inflammation which is supposed to be there becomes 10 times more. So therefore the symptoms are increased much more because of that. Okay, so that's one of the theories that is now acceptable, because it's acceptable to understand that this is why this happens to somebody. So why does the lesion allow itself to grow?
Right.
But what made the lesion come there in the first place, whether it is retrograde menstruation, which is debunked now, the theory of Sampson's retrograde menstruation, or whether it is coelomic metaplasia, means some cells by themselves changing into endometrial cells. So these are some theories which are there, but we have not had any conclusive evidence to tell us which one is which as of now. Yeah.
And is estrogen the villain also?
Estrogen is like it's naturally there, and when it is there, it is going to benefit the endometriosis. So it's just big. By the way, it is also doing this. It's not.
Right.
It's not the cause. It's just going to.
So it makes it worse.
It just helps it to grow. Yeah. But it's not the cause. It has grown. It has grown, but estrogen is a very good source of food for it. So
Right.
that's why it just allows it to grow. But it's not the cause of it. No.
Right. And I'm coming to treatment and management now. Tell us about the clinic, the endometriosis clinic
Yes.
that you started in Kokilaben Hospital,
Yes.
and it recently got a certification. So talk about that and what the clinic does.
Right.
What kind of women and patients should come to this clinic?
So we started in 2017, the endometriosis clinic. Basically, the best part about being in this institute is that all of us are full-time doctors and we are available all the time. So there is a lot of cohesiveness in terms of treating. And endometriosis, like I said, affects the entire body.
Right.
So patients are going to come with various symptoms which are not always something gynec should be looking at. Sometimes it requires psychiatric help, sometimes it requires a physiotherapy help, sometimes it may require a gastrointestinal help, So all those things are to be there. But at the same time, what happens is, if I send you to someone who doesn't know how endometriosis is impacting, say you're getting IBS, and we know it's endometriosis related bloating, but the gastroenterologist is not tuned to this particular part of the aspect of endometriosis, then your treatment is going to be very variable. So that's where the clinic helps, because it's a very cohesive unit of consultants, specialists, who we have a consensus about how we treat our patients for endometriosis. So when I send you to someone they will know what is to be done for them. They know what is happening to them. There are no random 10,000 tests being done from them, because we know what's going on here with the patient. Secondly, surgery is never going to be, endometriosis surgery is always a very difficult surgery to do, because there are so many adhesions, there are so many disruptions of how the organs are located inside the body. So here again, multi-speciality makes a very big difference. So having a colorectal surgeon, a urologist in-house and able to tackle the disease, because the method of doing the surgery is also very different. Okay, like say for example, if you have endometriosis on your intestine, generally intestine cancer surgeries which are very radical. They destroy nerves, and they are dissecting far more than what endometriosis requires. Now this is where, when you are working with a particular colorectal surgeon and you are in that unit and you have discussed the patient before and you know what to do, you are going to do what's required. So the patient doesn't go back with a morbidity or the side effects which were not really required for endometriosis. This is not cancer surgery where you have to be very radical.
Right.
You have to plan your surgery in such a way that the patient goes back being as less of side effects as possible from the surgery. So that's where the center helps, because we have regular meetings and we discuss our cases before surgery and we discuss our cases after surgery. We also have our radiologists who are tuned to checking the patient for endometriosis. So, like you said, how do you diagnose, or diagnosis is so difficult?
It often takes years, right?
Absolutely.
Yeah.
So, if your ultrasound is not done in a particular manner, then you are likely to miss certain points of endometriosis which can be seen on ultrasound. If your MRI is not done in a particular manner, not read correctly, then again you're going to miss endometriosis there. So that's where having a team which is meeting together, we are all on the same page, it made a very big difference. So when I started this off, this is what we did, and then we researched to look around to see, because everywhere else abroad, endometriosis is treated only by specialists. It's like, to put it bluntly, if somebody was having, say, an ovarian cancer, and it was operated by somebody who is a general gynecologist. That is not correct in today's time, because the expertise is not there as an oncologist should be. So at least the oncologist should be a part of the team, if not doing the actual surgery. So it's the same thing with endometriosis, because here you are looking at lesions which could be very different. You have to make decisions intraoperative sometimes to say, should we remove this much, should we remove less. Now all of those things cannot be done by unless you've had a certain amount of training for this.
True.
And overseas, abroad, pretty much everyone is referring patients to endometriosis specialist only. So that's where I felt we should have a standardization done for what we are doing. So in a way, it was like a check on us to tell us, are we at the international standards or not? And at the same time, it was making sure that we are streamlining how we approach to a patient. So whether it is from your history taking to how your what investigations are done for you, what consults are done for you, what help you need, all of that is taken care of under one roof in a certain streamlined manner. So that's where our recognition made a very big difference, I think.
Can you briefly talk a little bit about the process of this recognition? Because patients are very curious to know these details. So how did that happen? Like, did you have someone come? Or
so we, European Endometriosis League is a league of doctors who are experts in endometriosis in Europe, who have basically formed this league. Essentially, they hold congresses, they hold meetings, webinars to talk about latest developments, research, all of it. And they have a certification system. So what they have done across Europe and UK as well is that they go and inspect the center. You have to have a certain number of cases you're doing through the year, which are complex cases. You have to have a team of people who should be involved in the care of the patient. There should be a method of doing the surgery. There should be an ultrasound available for it. There are a lot of criteria that were there. So it took me almost a year and a half to build up all our criteria up to what their level was, before which they actually came to audit my work. So they came here personally, and they audited all our work that we were doing here, including operative videos, including how we document everything, how we write everything, how we investigate, how the facilities are, everything. And that's where they kind of did. And so we are the first people in India and Asia actually to get it.
Congratulations. It's such great news for patients, because in my years I remember there's various symptoms. There were various symptoms. And I used to come to you often. And one of the things I wanted to again touch upon is the pain management. From those years of endometriosis, I remember, the thing I remember the most is the pain. It's this debilitating pain, right? Which doesn't sort of limit to your periods. It goes, it can come anytime. So is there something new update on pain management, how pain is managed beyond painkillers?
Absolutely. So there has been locating pain stressors. What is it that is causing the pain? So pain and taking a painkiller but not actually figuring out where the pain comes from. That is basically defeating the whole purpose of trying to treat a patient, because anybody can take a crocin and get relief from pain. But do you know where the pain is coming from? So that's where, if a patient has come to you with pain, you have to evaluate to see where the pain is coming from, whether it is your endometriosis itself, whether it's neuropathic pain. So sometimes these patients have had chronic pain, they have excitation of their nerves, and there's neuropathic pain that is present, which requires different kind of medication. Sometimes it is just spasm, pelvic muscle spasms, and all they need is good pelvic relaxation physiotherapy. So our physiotherapist here is actually tuned to giving this. So sometimes it's just that they are otherwise okay, but they just need that to relieve them of that pain. Sometimes a pain management specialist even has given blocks and injections and things just to relax the muscles and give them the pain relief that is present. Pain, you have to figure out where the pain comes from, and once you know where the pain is coming from, your treatment can be there. A lot of patients will come with pain who actually have interstitial cystitis. So they are having pain and they feel it's endometriosis. They've taken treatment for endo, but the pain is not going away. But it's actually coming from the bladder. And they go hand in hand together. So then again, you have to figure out if this is where the pain is coming from, and then accordingly treat the patient.
And staying on the treatments, so is there any new kind of treatments now, say compared to a few years ago? And just generally talk about the kind of treatments that are available.
I think the approach to treatment has changed. So earlier on, probably there was a lot of use of GnRH agonist injections, which basically block your periods completely as a method of completing your surgery. That was instead of doing a radical surgery, that was what used to be there before. But things have changed now. So assessment of patients, depth of the lesions, whether it's deep infiltrative endometriosis, then surgery is the only option. You should not be doing medications for deep infiltrative endometriosis, because that has a lot of damage it is going to do to other organs. So then you have to do for surgery first. Mild endometriosis medications can be an option for someone who's younger, not looking for fertility. Again, fertility, if it is there, then you would first want to go for surgery. So a lot of multiple permutation combinations available for treatment. But let's say in terms of how you approach the patient or what treatment you do, I think surgical point of view, the robotic system is the most advanced method of doing minimal access surgery now. And the biggest advantage in endometriosis is the vision, because it's a three-dimensional high definition vision. So you see very, very clearly. And I am looking at it as an immersive view. So there's a robotic camera that comes to me and I look inside, and I'm looking right inside the abdomen of the patient. Okay. So I'm able to take the telescope to where I want to go and do the surgery. So that way, that vision has actually been a very big game changer in terms of how well the surgery happens. There are ECG dyes available to look for patency, to look for vascularity, identifying lesions, all of these things. So in technology point of view, that's where it is at. Medical point of view, there has now recently a 4th generation progesterone which was available. Dynogest has been available for a few years, and recently India has developed the oral tablet of GNI. So instead of the injections, there's an oral tablet available. But see, these medical managements or even the GnRH oral medications have to be given to certain people. Not everybody can be on it, and not everybody will get relief from those medications.
So it has to be personalized.
Absolutely. Absolutely.
What about the connection of endometriosis and cancer? Ovarian cancer or uterine cancer? Like say 7-10 years ago, it was thought that there is no connection, but is there? I mean, I don't know. Are you seeing a lot of patients coming with cancer after endometriosis? Not
lot of people, but endometriosis associated cancer is a known entity. So patients, see, what happens is endometriosis is a focus of inflammation. It's a focus of swelling of tissue around the uterus, and this continuous irritation and focus which is happening is sometimes induces changes which leads to cancer. So that's where the inflammation is the one that's inducing cancer. So endometrial associated cancers are seen more commonly in ovarian. So you have either 2 different types of cancers, clear cell carcinoma, mucinous carcinoma. These are the ones that are more commonly seen in endometrial associated cancer. And uterus cancer, adenomyosis, not necessarily increasing your risk as such, but definitely ovarian, fallopian tube and peritoneum cancers can be increased because of the irritation that the endometriosis has caused over a long period of time, the inflammation that it has caused.
And so in terms of prevention, right? What would you say to today's girls, say to parents of teenagers, adolescents? I mean, for inflammation, of course, lifestyle matters, right? Any inflammatory condition, your lifestyle will matter, exercise. So what do you tell girls? How do we, even PCOS is on the rise, these kind of chronic conditions are on the rise. So what do you want to tell young girls and parents of young girls? So
the first thing that I would like to tell specifically for patients of PCOS, of course endometriosis also to some extent, but when we were hunters and gatherers, we would be working for 10 hours to be able to eat for an hour, okay? And the ratio has reversed now. So you can eat for 10 hours because all you have to do is punch buttons in your phone and food will come to you. You don't have to work hard to get your food. And so we've started eating too much and from not very good sources of with too many chemicals, too many preservatives at all. So I think that's, you have to be very mindful of what you're eating. Very, very important. So whenever you are, tempted to eat things from outside or just call certain companies which deliver food to you immediately, give it a thought to say, do I really need to eat this? So get back to your basics and eat food which is healthy, wholesome, made at home preferably, which is not having any additives, any preservatives, because they are all harbingers of some or the other issue that's going to happen to you, because after all they're chemicals, so they can't all be normal as such. So get back to what probably your grandmothers were doing, in terms of eating that kind of food, and be active. So, make sure that you are doing some physical activity through the day. In terms of endometriosis, unfortunately, there is no prevention because there are epigenetic factors. So, factors which are there in your environment which make you develop endometriosis. So, you may have two sisters. Out of them, one has bad endo, the other one may not have anything. So, the epigenetic factors is where all these lifestyle factors come into play. So, your exposure to chemicals, your exposure to preservatives, pollution around you, the kind of food that you eat, your lifestyle of being sedentary, not sedentary, they make a difference into it. So, you basically have to become that hunter and gatherer who is going to work hard and then eat little bit. Right. That's basically it's going to be. Yeah.
Wow, wonderful. And how do you see, you've been sort of in all conferences, you're in tune with all of that. How do you see the future in terms of, do you see a cure coming? Or
so far
there's even a talk, there's even a talk of a diagnostic test that's supposed to be being developed. So talk a little bit about that.
So these studies are still in process. We have a very small Indian study which has been done in the south, in Trichy actually. She's a very senior gynecologist, very much in our part of our Endometriosis Society of India. And she's actually conducted this study to look for mRNAs in your blood to detect endometriosis, association of these two, right? But all of these are still in their infancy stage. We are not conclusively there yet to say, okay, this is going to be the thing that is there. I don't think we've reached that stage where we can make a instant diagnosis, especially for adolescent girls who have very small peritoneal endometriosis, which is not really visible on sonography, MRI, but the patient has pain. But you suspect it clinically, but there is nothing else to back you up. So that's where you need a blood report to maybe convince yourself and the patient that maybe you have endometriosis, you need treatment. Unfortunately, it's not conclusive yet. So we are still in the process of maybe standardizing and saying, okay, if you do this test, you will know. There are some other biomarkers also people have come up with, but none of them have been conclusive enough there we can say, okay, yes, please do it, and we know you have endometriosis. So it's still clinical suspicion and diagnostic tests in terms of ultrasound, MRI, which help to diagnose.
So the future seems to be right now like holistically managing the disease.
Yeah,
right?
Actually there's a lot of research also recently going on anti-inflammatory medications for endometriosis. So just like how I said, this is an inflammatory condition. So far all these years our focus has been on hormones, because the catamenial nature of this particular pain that always occurs with period every month, and that is a very classical thing, that your pain will always be, no matter where the pain is, the pain will always be associated with your periods. The moment your periods are about to come, it will happen and it will get better after that, and you're normal for 10-15 days and it comes back once again. So this cyclical nature basically indicates that it is so basically all our research so far was on looking at hormones controlling endometriosis, because the nature of the disease was such that it was always cyclical and coming with periods every time. So we all believe that it's uterus lining which is coming in through the fallopian tube, growing everywhere, and we have to control it with hormones. That was the thought process which is there. But now that we have proved that this is actually inflammatory lesions, not necessarily coming from the endometrial lining, and it can grow anywhere, the whole process is that we have to try and find a way of controlling the inflammation, because that's where the problem starts. When there is inflammation, there is swelling. That's when all the blood supply, the RBCs, WBCs, fibroblasts will come in, and then the fibroblasts will form this fibrotic tissue which is becoming a hard tissue. Then it starts invading other organs, it starts pressing on nerves, and so on and so forth. Is a pathology of the process. So if we are able to control the inflammatory process and reduce the inflammation, obviously patient's disease load is going to get better.
Right.
So there are studies now that are being done to check if there are anti-inflammatory medications which otherwise people use for autoimmune diseases, whether they are actually helpful in endometriosis. So I think I probably see a hope there, because conversely we sometimes find patients who are on alternative medications which are also focused on reducing inflammation suddenly come up with no pain. So they actually feel better with that. So maybe yes, that may be a very promising thing happening in the future.
Yeah. Okay. So that seems like something we can look forward to, and at least the thinking has changed. There's more hope. Thank you so much, Dr. Kulkarni. Keep up your good work. Congratulations on the clinic.
Thank you so much, Sanjita, for this and giving me the opportunity to speak to everyone. And I think kudos to your slow fix.